Hey guys, this is Dr. John Mark Chesney with Simply Physio. And one topic of discussion or treatment that we utilize a lot and we get a lot of questions about is trigger point dry needling. Sometimes we call just dry needling for short. And so I want to go over the top 10 questions that we regularly get asked here in the clinic so that you have all your answers that you need to know about dry needling. And you'll be able to see also later in this video a demonstration of what it looks like as well. So first question is, what is dry needling? So dry needling uses a small needle. It's called a monofilament. It's equivalent to an acupuncture needle. There's really no difference. So it's a small, tiny needle that we utilize into puncturing the skin into the muscle to create a response within your plan of care, within your treatment, to make a change within the tissue that we can capitalize on to ultimately help improve movement, release tension, and help to reduce or eliminate pain. So the second question is, how does dry needling work? So when we utilize the needle, we'll typically get change in the muscle. Oftentimes you may feel a twitch response. And so that twitch response is like a little muscle spasm. Sometimes it just goes once, sometimes it goes 3 or 4 times. Some cases, in some muscles, you may not get much of a twitch response. You may not get one at all. But you'll feel some tension or a release of that tension. We can use it really in 2 cases. One is when you have a locked up muscle, a muscle that's really tight and tense. We need to relieve that tension so that it can fully lengthen to help support your body and support movement. So we can utilize the needle to help to relieve that tension so that muscle can fully lengthen. The other situation where we would use dry needling is if there's a weak muscle or a muscle that is not contracting, not supporting you like it should. In essence, we need to facilitate that muscle. We need to encourage that muscle to elevate its game, to really activate appropriately to support you. So we can also use dry needling to help to activate muscles that have been deactivated or just kind of dormant along certain pathways of your body. The next question is, how is it different than acupuncture? So acupuncture is based off of Eastern medicine, Chinese medicine. Acupuncture involves energy flow, balancing the qi to make change. And acupuncturists will use acupuncture for various sorts of ailments. Can involve muscle and joint issues, but they'll use it for other things such as the common cold or different hormone release or depression, a host of different issues. So dry needling is very specific to what we do here in physical therapy. We view the human body differently than an acupuncturist, in that our training is understanding movement, understanding the muscular system, understanding the skeletal system, the nervous system. And so we can use the needle to change movement, to improve movement patterns. A few other differences. Typically an acupuncturist will use, oftentimes they could use 100 different needles all over your body, and when you would go in for a session, you would have the needles and then you would just rest there for the whole session. So the session in itself is just the needles for an acupuncturist. When we're using dry needling, it's just a part of your treatment, right? So we want to encourage and improve movement patterns. And so we'll use a needle to do that, but then we got to get you moving. We got to get the right muscles activating. So it's a piece of your session, but it's not going to be the only thing you do within a session. Next question is, does it hurt? That is a good question, and to answer that specifically, it really depends. Dry needling in the hands of a skilled practitioner should be more comfortable, but it's going to depend on your tissue. If you're dealing with a really chronic, just a really big trigger point that's kind of nasty, if you put your thumb on it and it hurts a whole lot, chances are the dry needling will also create some pain. But the advantage is, instead of just having to plow into that muscle knot, doing some deep tissue release that can be agonizing, and can take 30 minutes to work out with a deep tissue massage. What we can do with a dry needle is we can release that muscle. Instead of taking 30 minutes, we can do it in 30 seconds. And so we just get straight to the point and can create a huge change in that muscle quality, so that we can then move on to the next thing. There's many muscle groups where you may not feel much at all. But what I tell people is, if you're not feeling anything, we're probably not doing anything. And so when you're here receiving dry needling here at Simply Physio, we want to make sure that you're comfortable. We want to make sure that you're tolerating it well. And so there's always this back and forth of, how are you feeling? Are you feeling okay? Are you tolerating it well? By and large, most people do great with it. If dry needling is not for you, if you're going to be losing sleep over it, if you have a needle phobia, it's probably not your best treatment, and we got other options that we can utilize to help. What does dry needling feel like? So typically you'll feel a little prick when it goes in, sometimes not much depending on the sensitivity of the area that we're in. But more often than not, you may feel some pressure, you may feel that muscle twitch, or you may sometimes get a referred pain pattern based on what tissue we are targeting. Is it safe? It should be. We use clean, sterile needles. Needles are disposed of after they've been used. They're not reused. They're not recycled. All therapists should be using clean, sterile techniques as far as gloves, sterilizing the area. And there are some sensitive areas of the body, such as around the lung field, around the rib cage. And so you want to make sure that the therapist you're working with is confident, has been through the level of training when dealing with more sensitive areas like the lung field. There have been cases of people having a punctured lung, but that should never happen when appropriate precautions are taken in the hands of a skilled provider. How should I feel afterwards? I tell people I would expect to see a positive change immediately after your dry needling session. You should be able to tell the difference. Now, sometimes that's masked because you're going to be a little sore, and so some of that full benefit may not be realized until that soreness dissipates. Usually within 12 to 24 hours, you can see the full impact of the benefit of dry needling. Can I do anything after my dry needling session? So there's a few things that you can do to further help complement the benefit of your session. One is stay hydrated. Needling will not go as well if your muscles are deficient of water. If you're dehydrated, it's just not going to take as well. The other thing too, I like people to get up and get moving, even get in a little bit of cardio, whether it be just to go out for a walk or a jog or something just to get your blood flowing. That'll help to complement your session. Sometimes even using a moist warm pack or a hot bath, if something's really sore, that can help just to relax the area as well. All right, guys, we're down to the last two. Who can perform dry needling? So in the state of Tennessee, therapists are allowed to perform dry needling. You have to go through a certain amount of hours of training to be allowed to do it within your license. And so there's many therapists that are practicing dry needling that have been through at least the foundational level of coursework. Now, there is a difference that you may look for a therapist that has initials after their name. So the initials after my name is CDNT, which stands for a Certified Dry Needling Therapist. So it's not as common for therapists to have that level of experience and training to actually have the abbreviations after their name. So if you want to make sure you're working with a therapist that's been through extra amount of training and application and usage of dry needling, then you can look for a therapist that has the credentialing, the abbreviations after their name, such as a CDNT therapist. And last question, how does dry needling fit into a treatment plan? So I mentioned briefly before that dry needling is not a standalone treatment, or at least it shouldn't be for you to get the best results. It should be mixed in with a treatment plan to help improve your movement pattern. When we combine both dry needling, some other hands-on work, and the right types of movement patterns of exercises, that's going to be the game-changing plan that helps you to get ahead of the game to help you actually reach your goals and get rid of whatever injury, whatever aches and pains that you're dealing with. It's when used in a full treatment plan where you're going to have the best outcomes. So that's the top 10 questions we get asked here at Simply Physio about dry needling. If dry needling is something that you're interested in, or maybe you've had experience with it before and you know you need to receive some of that, again, feel free to reach back out to us here at Simply Physio and ask how you may get started with some dry needling or a treatment plan. Thanks.